Hello, everyone. My name is Chris Purcell, and I'm a certified brain injury specialist and a neuro resource facilitator with the Brain Injury Alliance of Iowa. Today, I would like to give you some caregiver support and education for advocacy as we work towards making the invisible visible in brain injury. I'm a part of the resource facilitation team that is taking and making calls every day from survivors and family members of brain injury. Our team is supporting families navigating the system of supports in the state of Iowa. Today, I want to talk to you about those injury events when families have come out on the other side of recovery and their loved one is no longer significantly physically impaired by their brain injury, but instead struggling with cognitive and behavioral challenges. Due to the very nature of these struggles, it tends to make brain injury invisible to the general public and more challenging when they try to access supports. So, where do we start? If you're supporting a family member who was never able to return or tried to return to full time employment after their injury, but was later unable to maintain it, then the process of getting onto Social Security disability benefits will or has been a part of your experience. These are the things that I hear from families every day. They survived their injury event, they went through rehab, but they're still struggling. People say they look fine. You can't tell by looking at them that they even have a brain injury. As loved ones, you know where the struggles are, even if you can't put your finger on it. To everyone else, the brain injury has become invisible, but it's clearly not to you. I'm coming to you today to help you as families articulate your loved one's needs as to why they struggle to maintain their own home or even keeping a job. It requires getting into the weeds, so to speak, when you're talking with professionals. It really helps to take notes about the things that you see your loved one struggling with, even if you're not sure how to put your finger on what's going on. Something to think about is that some mild traumatic brain injuries and most severe injuries can cause permanent damage or impairments. According to Dr. John Corrigan, PhD, in his article Traumatic Brain Injury as a Chronic Health Condition, injury to the brain can evolve into a lifelong health condition termed chronic brain injury, or CBI. Chronic brain injury impairs the brain and other organ systems and may persist or progress over the individual's lifespan. Chronic brain injury must be identified and proactively managed as a lifelong condition to improve the person's health, independent function, and participation in society. Part of managing and maintaining independent function in society may require accessing some community-based support services, either through a person's Medicaid or managed care organization or privately paying when a person has the resources available to them. Once a person has been determined disabled by the Social Security Administration, then they are able to get on the brain injury waiver waitlist. Currently, that waitlist is about 2 years long. So I'm going to share today some supports that are available to you and your loved one while on that waiting list. I'm going to give you some basic information today about those of us who specialize in supporting stakeholders in the brain injury community referenced as barriers related to brain injury. If you have any questions about this information, you can call the Brain Injury Alliance of Iowa at any time. If you need help in advocating for your loved one, please either email us at our info line at info@biaia.org or call our 1-800 line at 1-855-444-6443 and be connected to our neuro resource facilitator who can help you with connecting to supports or just have someone to stay connected to in navigating any of the processes I talked to you about today. I'm going to give you some information today about identifying the areas where your loved one may struggle in the language of professionals who are assessing their needs. As we talk about definitions of ADLs or activities of daily living, or instrumental ADLs or instrumental activities of daily living, for example. Dr. Kristen Massanio, occupational therapist and interim director of rehab services for the TBI clinic at Fort Belvoir Community Hospital in Virginia, She defines activities of daily living are the things that we do absolutely every day, from the moment we wake up in the morning to the moment we go to bed. So if we took apart our day and we talked about rolling to sit up on the side of our bed and walking to brush our teeth, anywhere from getting in and out of the car, in and out of the bathtub, washing, dressing, anything we need to do every day to make our life meaningful. And then we have the different category of activities of daily living. They're called instrumental activities of daily living. And those are kind of a bit higher level. So we're talking about grocery shopping and performing work and leisure activities so that we have a holistic view of the person. We want to make sure that not only can you dress and bathe yourself, but you're able to complete those activities that are meaningful to you as well. When you make attempts to connect your loved ones to services, they're going to be asking questions about those two different categories of skills. So their awareness on how well they function in each of those areas also is going to play a huge part in whether or not they get those services. So keeping that in mind, if you're able to participate in any sort of assessment meeting or provide additional information to those professionals, it's only going to help in identifying your loved one's needs. So, what information is going to be the most accurate picture of your loved one's needs? The gold standard is going to be a neuropsychological exam. And that exam is completed by a neuropsychologist. And depending on the severity of an injury, this testing may or may not be completed. The testing takes roughly 3 to 4 hours, depending on how much a person's struggling with the exam questions. And it's not always necessary to have a neuropsych test completed, depending on a person's situation. However, if they are in need of supports and services and that test hasn't been completed, then the Mayo Portland Adaptability Inventory is also an acceptable tool to identify those barriers as a supplement. The Mayo Portland Adaptability Inventory was developed by Dr. James Malik at the Mayo Medical Center for the Center of Outcome Measurement and Brain Injury. This tool can be completed by anyone who knows the survivor's barriers as a result of their brain injury. So it could be a family member, trusted physician, etc. This tool specifically assesses key areas that no other assessment does as it relates to brain injury. The impairments related to cognition, which is refers to a person's ability to know, think, understand, reason, related to memory, etc. So it can affect novel problem-solving skills, which is picking the best solution to any new problem. It requires flexible thinking and multitasking, planning, and organizing. So as I'm throwing those out, you're going to identify that if you see some more rigid thinking, that there might be some issues related to problem solving and being flexible in one's thinking. There could also be a perception of impulsivity too when there are barriers related to novel problem solving. A fund of information also is cognition issue. Remembering any new learned information is what that would look like. And then if there's difficulties in remembering information about yourself, even from years ago or loved ones, there would be deficits in that area. So there's impairments in executive functioning that refers to cognition that controls other abilities and behaviors. For example, nonverbal communication. If a person struggles with, they miss those nonverbal cues in social situations, there would be a deficit. And then also if a person has impaired self-awareness or a lack of recognition of personal limitations and disabilities and how they interfere with everyday activities and such as work and school. So if a person also may have issues with anger expression and or an increase in marked irritability or low frustration tolerance. And then also it's going to shed light on initiation where no other tool does as well, where there's most certainly a plan to do something, but just getting started requires cues and alarms, scheduling it, making sure it's routine. So otherwise there's that initiation where there wasn't prior to the injury. We've also developed a supplement that allows you to add the number score that you would have come to at the form here or on the right, but then also elaborate, provide more detail about that person, about your loved ones, deficits about specific situations. So we can most certainly provide that supplement at any time. And currently, the Brain Injury Alliance is contracted to provide as a fee for service, completing the Mayo Portland adaptability inventory for every individual seeking and receiving home and community based waiver services in the County Social Services Mental Health Disability Services region of the state. And we're in a discussion with another region to begin providing this as a fee for service. However, for those areas of the state where we're not providing that as a service, we're able to provide that assessment and the supplement, and then also technical assistance as needed as people are getting those completed and turned in to providers. So when you're talking with non-brain injury specialized professionals who are assessing your loved one's needs. That may occur, for example, if your loved one has made it through the Social Security determination phase and been awarded Social Security as a result of their barriers related to their brain injury and or a combination of other multi-occurring issues like mental health issues. Then they might be eligible to access other supports through their Medicaid or their managed care organization if they're actively receiving treatment. So they can call the 1-800 number on the back of their card and reach their case manager and ask for a referral to an integrated health team. However, if anyone has the ability to privately pay for brain injury specific community based services, then that's always available as a first line of supports. However, if your loved one is on the brain injury waiver wait list for services, then connecting them to other supports they might be eligible for while they're waiting can be a good course of action. So some recent changes have occurred in the availability of these mental health supports, which now makes them only available to those who have high intensity needs. So that's something to consider about your situation. The managed care case manager determining the person's needs, um, whether or not they're high or low, for example, would be completing this locus assessment tool that you see here to the right. Your loved one can receive a copy of this assessment tool along with the 8-page evaluation parameters that shows how they came about that score. And then it also determines whether or not they have high or low needs. So I want to talk to you today about 4 specific areas where a person's brain injury is going to be the most impactful on any underlying mental health issues. So the first being comorbidity, and second, environmental stress, environmental, and then also levels of stress, treatment history, and engagement. And then if at any point you feel that the managed care case manager does not have all the information or has inaccurately assessed your loved one's needs, you can ask for a reassessment. And then once again, your input's always invaluable in making sure that they're aware of all of your loved one's barriers related to their brain injury, their mental health, etc. So, um, just uh, full disclosure, I need to let you know that I worked many years in mental health, serving those with multi-occurring barriers, including brain injury and mental health, and completed thousands of level of care assessments, um, such as this and others, to those seeking support services. So you'll benefit today from my experience. So it's important to note that when you're talking about functional status to a provider who's primarily serving your loved one based on their engagement in mental health services, they want to know how those mental health issues are firstly affecting their ability to function day to day, particularly with those activities of daily living and then the instrumental ADLs as well. So however, the mental health professionals are also looking at comorbid conditions. So, comorbid is when there is more than one condition that is in existence that's affecting a person's ability to function. So, co means two, and then multi-occurring obviously is when there's multiple issues where a person may be struggling. If they have physical impairments or physical health issues, brain injury and mental health, for example, could be a multi-occurring, uh, you know, issues that they have. And it's important to understand that as you're explaining to these professionals that they understand that their brain injury is affecting every part of their life and to the extent that it does. And so, for purposes of this locus assessment, if a person has a brain injury, it would be categorized as a medical illness since it was a medical occurrence that caused the injury. So, as they're looking at these comorbid conditions and they're looking at how they provide complications to mental health recovery, et cetera. So, and if you feel that their brain injury is clearly and detrimentally, adversely affecting their ability to manage any mental health issues, then you can make sure that those professionals understand that it's significant and it's a major comorbid condition to them being able to uh, manage their mental health issues. So, if they, for example, struggle with planning and organizing appointments, medications, things like that, then they're going to continually struggle despite all their best efforts. And the mental health professionals are also looking at levels of stress in their environment. So, for example, if they've lost their job, they're struggling in their marriage, then their situation would be considered moderately stressful. So that would give them a higher score that would then speak to high intensity needs, for example. If there's been a divorce or separation of parent and kids, criminal legal issues, that would also be considered highly stressful. So, treatment history is another area that they're looking at. So, if they've, for example, they continue to show symptoms and no change in their abilities despite beginning medications and working with a therapist, their response to treatment would be considered negligible. So these are all important to make sure that they understand uh, their current mental health engagement and services and their current functioning as it relates to their brain injury abilities and their barriers. And the last I look at is engagement. And so in this particular area, it can be impacted greatly if a person has an impaired self awareness since their injury. So they may have a lack of recognition about their limitations, and that could be interfering with their ability to engage with those mental health supports. So if they relate poorly to their providers or they have a, a narrow ability to trust, then they considered minimally engaged. So it's important to make sure that the case manager has the most accurate picture to make sure that your loved one's getting the support that they need. So I'd also recommend that the case manager get a copy of that neuropsych exam if there has been one, and also make sure that they get a completed copy of that Mayo Portland exam. So, and they can make sure that they're monitoring your status on the brain injury waiver wait list and enrolling once your name comes up on that waiting list. So once you're beginning to work with the home and community-based waiver professionals, you have the opportunity to then access those brain injury specific services, which are provided by CBIS certified or certified brain injury specialists. And so they understand brain injury, and the goals then can be uh, specific to that injury. A person will be assessed by a third party. Currently, that's Telligent. That assessment, which is the inner here you see, is turned into the Department of Human Services and reviewed by a third party. And those um, professionals at Department of Human Services can be the neuropsych exam and the Mayo Portland can be submitted to those reviewers at the Department of Human Services as supplemental information because we've identified specifically that the NRA limitations do not cover these seven areas where a person would have some common barriers related to their brain injury, and the Mayo Portland sheds light on and makes these issues visible and in assessing a person's injury and to what extent. So, in nonverbal communication, the novel problem solving, visual spatial abilities, which is navigating through a space, which um, irritability, anger, aggression, sensitivity to mild symptoms, impaired self awareness, and then initiation. So, um, you'll notice that all of these areas are not only necessary for activities of daily living, but more commonly for those instrumental activities of daily living. So the Mayo Portland is um, what our executive director, Jeff Lauer, he released a position letter on May 16th, or I'm sorry, May 1st of 2016 that stated the Brain Injury Alliance of Iowa demands that a supplementary tool be used for accurate and appropriate assessment of Iowans with the unique disability needs related to brain injury. Such an adjunct tool must have the capacity to assess cognitive function, memory impairment, learning difficulties, judgment and decision making, or executive functioning impairments. So, as we look at 6 of those 7 um, barriers related to a brain injury, we need to think about your loved one and their need areas. These, once again, are all related to cognition and executive functioning that appear as possible behavioral issues. If a person is struggling with initiation, it may look like they are refusing a service or refusing to participate when in turn they had every intention or a plan to engage, but they just needed cueing or needed it to be implemented as a part of a routine. And they are, more than willing to participate, but that go button, so to speak, is impaired as a result of their injury. So, as one example. I also want to provide a few tips for you too. If your loved one, has struggled, for instance, with some executive function, there are some things that you can really help them with, and some of those things are, for example, learning what to recognize what their triggers are. Sometimes distraction or redirection before a situation can get out of control is helpful if you are aware of those triggers. Um, Practicing in those responses and having a plan for how to leave social situations when there are triggering events can also be, really helpful for that person. Being sensitive to situations that may have too much stimulation or be overwhelming, and then also, if they do struggle with anger, for example, then help limit distractions. Changing the topic if there's increased agitation, making sure that we're always speaking calmly and providing reassurance helps with the management of that anger. And then also providing feedback, asking them for feedback on understanding what was said to kind of reduce misunderstandings or avoid arguments. If you want to help your loved one improve awareness and attention or concentration, you can help them by organizing a task before they get started, making a list and then prioritizing those, for example, helping them do one thing at a time, and then also staying calm and cool to help keep that anxiety low. Break difficult tasks into smaller, simpler tasks. And if you want to help them improve reasoning and judgment, you can encourage them to consult others if they are tackling a problem. Everyone should be checking their ego. No, none of us are omnipotent. Encourage them to gather data from different sources, and then brainstorming is always useful. And then helping them review outcomes, from previous situations and what they did and what worked and what didn't work. And we're here to help. If you're looking for a one-time resource, you're welcome to call or email us at our contact information here, the 855-444-6443, or you can email us at info@biaia.org. However, if you would like to be connected to a neuroresource facilitator for follow-along assistance, you can call or email us at either of those contact information and ask for an intake. And our intake coordinator will gather some basic information to make sure that you're connected to a resource facilitator in your area. So we currently have offices in Urbandale, Iowa City, Waterloo, and Sioux City. And I hope your loved one is able to articulate how much they appreciate all you do for them. If they're unable to, then we here at the Brain Injury Alliance would like to convey our most sincerest gratitude for your support of your loved one's continued recovery. Your presence here today reflects your love and concern. Thank you.